Welcome back, and in case you're joining us now, well, we're talking about the health workers' strike, which has been on now for quite a number of days, and looking at what is it that will need to be done for us to have it called off. We have Peterson Wachira, who's the chair for Kenya Union of Clinical Officers, and Boaz Onchari, who's the chair for Nurses Union, Nairobi County. Gentlemen, we have 5 minutes or so, what I'd need now is possibly your closing remarks, and I'll start with you, Peterson. If you had an opportunity to address the president, in regards to this, what is it that you would tell him? What is it that you would want him to understand that maybe he hasn't understood so far?
Thank you, Michael. Allow me to address the public, to address the former Prime Minister and the President. To the public, you have a right to the highest attainable standards of health as per Article 43 of the Constitution. You also have a right to ask your leaders and to take them to account on how they are facilitating you to ensure that you actually get the right to the highest attainable standards of health. So you should join us in asking your leaders what they are doing to facilitate you in attaining the same. To the former Prime Minister, who we respect so much, Raila Odinga, in 2017, during the doctor strike, you told the nation that the only solution that we'll have in the health sector is to have a health service commission to manage the health human resources. What has changed? We would like to be with you and to pray that you reconsider so that we can have the solutions, as you said, in 2017, and so that we do not have to continue having these service interruptions at a time like this. To His Excellency, the President of this country, and I must say that we support your government, and we are very happy that you prioritized universal health coverage as one of your 4 pillars for development. The biggest threat to the attainment of universal health coverage is the mismanagement of the human resources under the county governments. As we stand today, the employment policy on contractual basis poses the greatest risk to the highest attainable standards of health in the next 2 or 3 decades. If we continue with these contractual employments, in about 2 to 3 decades, we will not have any specialist or a consultant in this country. Kenyans will have to travel to the neighboring countries to get some consultation or specialized care that they are actually getting now in Kenya, and it's posing a threat. The Health Service Commission is the only solution that is coming to ensure that there is no service interruption and will ensure that Kenyans get access to health care they need and to the highest attainable standards, because this will also address the employment policy in the health sector, and that is the biggest solution and the biggest strategy to ensuring that universal health coverage is attained. Right. And so we pray to you, Your Excellency, that you reconsider amending the Constitutional Amendment Bill to have a Constitutional Health Service Commission that manages the health human resources, so that we can ensure that their welfare is taken care of and there is no service interruption. All right, coming to the current strike, it's also our prayer, Your President, that you intervene so that we can be able to go back and see patients in an environment that is safe for us and safe for the patients that we take care of.
All right, thank you, Peterson. Boaz, your closing remarks and possibly your plea to the decision makers that are possibly, holding this back. What would your message to them be?
My closing remark is to our president, and I want to tell him that, dear Mr. President, you are the commander-in-chief of the defense forces of this nation. We are the foot soldiers in the health sector, and never at any given moment could we want to let you down. The guys that you've mandated to ensure that we are facilitated for us to give our services efficiently have failed you. We cannot continue to see our colleagues die, other Kenyans die, because there is mismanagement of the health sector. It is high time you recall these people that you mandated, ensure that whatever mechanisms that we, or whatever that we as the health workers are agitating for are addressed. We are open to dialogue. Anytime your team has called us, we have always come. But the kind of delay that we are seeing is not going to help us. We need this issue to be prioritized so that the issues that we brought before the table can be addressed, so that we go back to our workstations to continue serving the nation as we had stated in our oaths. Thank you.
All right, thank you very much, Boaz Onchari, who's the chair for Nurses Union, Nairobi County, and Peterson Washira, who's the chair for Kenya Union of Clinical Officers. Thank you for joining us this morning just to deliberate and discuss the health workers' strike and where we are as a country. Gentlemen, thank you.